Colorectal cancer is the second leading cause of cancer-related deaths in the U.S. But here's the thing, it is highly treatable when caught early. However, 1 out of 3 eligible Americans do not get the recommended screening due to their belief that it's unpleasant or inconvenient, which it is. But today, we explore a more pleasant option that is saving lives.
I went for just a routine medical exam. He said, "Hey, you haven't had a colonoscopy in a long time. I think you're due for one." I said, "Well, I just soon not, if that's okay with you." And he said, "Well, here, I'm going to give you some blood tests and I'll get back to you."
Many people are like John, reluctant to do an invasive and time-consuming procedure. But with the help of the Shield blood test, you may not have to be.
My doctor told me about Shield and recommended it as a simple blood test.
This test, no one refuses it. Say I'll just draw blood, it'll take 2 minutes. Get results in a couple of weeks usually. And if it's negative, they're good, and if it's positive, then we can talk about the colonoscopy.
A couple of days later, he called, he goes, "Hey, I do not like the results of your blood tests." I followed through, got the colonoscopy. It turns out I had stage 2 cancer, colon cancer.
Shield is a game-changing blood test recently approved by the FDA for colorectal cancer screening. It's already covered by Medicare, which gives millions of Americans easier access than ever before.
Having caught the cancer in an early stage certainly prolonged my life. I enjoy skiing, I play golf. I don't know that I would still be here doing all that had I not taken the Shield blood test.
Joining me now is Dr. Sam Asgharian, VP of Clinical Development from Guardant Health, the makers of the Shield blood test. Welcome. I appreciate you being here.
Appreciate
and I
it.
appreciate this test.
Thank you.
So who is this for?
The test is basically for anyone who's eligible for colorectal cancer screening. So Americans 45 to 84 years old that are at average risk. So really nothing other than just their age that gets them screened.
One of the reasons that I don't recommend screening for people shouldn't get colorectal cancer in this age. I humbly believe that. We have great screening tests, but people don't do them.
That's right.
So this blood test will be a way of helping those people get screened?
Exactly. So to your point, 1 out of 3 Americans who are eligible are not getting screened.
Yeah.
53,000 people died from colon cancer last year.
It's ridiculous.
75% of them, to your point, were not screened or were delayed in their screening. So the goal is exactly that, to offer this simpler option, a blood test versus more invasive tests or more inconvenient tests, to get people screened that need to be.
Now, as people particularly women, get into their 80s, there is some risk of colonoscopy. So can I keep doing the blood test? People are going to live into their 90s these days. I'd like to screen them a little bit as they get into their late 80s.
Absolutely, right? Yeah. So this is the conversation for the physician to have, right? To your point, there's the label component that says, hey, up to this age.
Yeah.
As long as the test is negative and the conversations are being had and the patient, as you know, doesn't have signs or symptoms, they can continue to get the blood test.
What sets Guardant Health apart?
It's this, right? The data and the ability to use new emerging technologies. We can keep expanding these products, not just in colon cancers we've been talking about, but other indications as well.
How are patient outcomes generally, particularly compared to other things?
When you find colon cancer early, it's stage 1, it's a 91% survival rate.
So let's spell that out. So you can detect that early with this test?
Yes.
Any stage?
Absolutely, right? So we go all the way from stage 1 to stage 4. And as you know, stage 4, the drops all the way down to basically around 14 to 16%, right? So this is one where you really want to be able to have someone screened, catch it early before those signs and symptoms developed, and then be able to treat it and have them enjoy a long quality of life.
So generally, it will tell us who needs a colonoscopy now. Probably first thing we do colonoscopy for everybody, right? If you have positive tests.
If you have positive tests, it reflexes, to your point, to a diagnostic colonoscopy, so which is great because it could be treating and visualizing and confirming as well. We've used over 10 years of research and development to get the FDA approval for the Shield test, to get this available for Medicare beneficiaries out of the gate. We'll work for broader coverage and access, which again, as you know, this is a very diverse population that needs this type of technology. And we'll be able to then look at other diseases and their signals and be able to pick them up in the future.
And that's no doubt underway.
Absolutely, yes.
I'm hearing you say you guys are part of the personalized healthcare revolution, right? Which is, for people who don't understand, that each cancer in each patient is sort of its own unique disease in certain ways. But there are certain things that are in common you can screen for.
Exactly. And so the technology at Guardant Health has always been focused on exactly that type of personalized medicine where you're treating that specific tumor, not just a colon cancer tumor. And here we're working to detect those tumors, again, at those earlier stages when you can treat them.
Really interesting. Well, thank you, Sam, for joining us. And for more information, visit shieldcancerscreen.com. That's shieldcancerscreen.com. And of course, early detection can be the difference between life and death. Take action. Talk to your physician today. No reason not to be screened. And do not go away. We have some great guests coming up next. Be right with you.
I'm Danica Patrick. Catch me on Health Uncensored with Dr. Drew.